If you wake up, throw the covers off, stand up fast, and start walking right away, please listen to me for a moment. That simple morning habit may seem harmless, but for many older adults, it can be the very mistake that leads to dizziness, a scary fall, or a day that starts with your heart and blood pressure under stress. I want to talk about this because millions of people do it every morning without thinking, and many do not realize their body changes overnight. I see this all the time. A person wakes up feeling mostly fine, then the moment they stand, the room feels a little strange. Their head feels light. Their legs feel weak. They grab the dresser or the wall and wait for the feeling to pass. Many people shrug it off and say, "That's just age." But here's the part many people miss. It may not be just age at all. It can be a sign that your blood pressure is shifting too fast, that you are a little dehydrated, that your medicines need a closer look, or that your body needs a slower start in the morning. Morning is an important time for heart health. Your blood pressure often changes as you wake up. Your body has gone all night without water. If you take blood pressure pills, water pills, diabetes medicine, sleep medicine, or several prescriptions together, that early morning window can feel especially shaky. Add in a quick trip to the bathroom, poor sleep, or not eating enough the day before, and suddenly that first minute out of bed becomes much harder on your body than most people expect. Now, I am not saying you should be afraid of getting out of bed. I am saying you should be smart about it. A calm, steady morning routine can protect your balance, help you feel clearer, and lower the chance of a fall. And later in this video, I'm going to share one simple habit that can help your doctor figure out whether your dizziness is from low blood pressure, dehydration, medicine side effects, or something more serious. That small habit can make a big difference. If this already sounds familiar, I'd love to hear from you. Tell me your age in the comments, or simply say, "I get dizzy in the morning." If this kind of clear, caring health advice helps you feel more confident, please like the video and subscribe. And if you have a parent, partner, or friend who grabs the wall when they stand up, share this with them, because one safe morning habit really can protect independence. So let's make this simple. When you wake up, do not rush. Stay lying down for a few seconds and notice how you feel. Take one slow breath in and one slow breath out. Then roll to your side and sit up slowly. Sit on the edge of the bed for a little moment before you stand. Wiggle your toes. Move your ankles. Gently pump your feet up and down. That small movement helps your circulation wake up before your feet hit the floor. Then stand up slowly and give your body a chance to catch up. If you use a cane or walker, keep it close enough to reach safely. If you know you feel weak in the morning, do not try to carry laundry, rush to the kitchen, or turn quickly right after standing. This matters because when blood pressure drops too much on standing, some people feel dizzy, some feel foggy, and some faint. Doctors call this orthostatic hypertension. That is a big term for a simple problem. Your blood pressure falls when you stand, and your brain gets less blood for a moment. There's another reason this happens in the morning. Many people wake up a little dry. Not severely dry, maybe, but enough that they feel it. A dry mouth, dark urine, extra tiredness, or morning dizziness can all be clues. For many people, a few sips of water after waking can help, especially before coffee. But this is important. If you have heart failure, kidney disease, severe swelling, or your doctor told you to limit fluids, follow your own medical plan first. Your body may need a different routine, and that is okay. And let me gently say something about coffee. I know many people love that first cup. I understand. But if you jump out of bed, feel lightheaded, and then take your blood pressure right after coffee, you may get a number that does not tell the full story. If your doctor wants you to check your blood pressure at home, Ask exactly when to do it and how to sit. Rest first. Sit upright with your back supported and feet flat. Do not talk during the reading. Try to be consistent. Small details matter more than people think. Now this is important too. Do not change or stop your blood pressure medicine on your own because you feel dizzy one morning. Please do not do that. Sometimes the dose, timing, or mix of medicines needs a review, but that decision should be made with your doctor, nurse practitioner, or pharmacist. Morning dizziness can happen from blood pressure pills, water pills, Parkinson's medicines, some sleep aids, and even from taking many medicines together. The answer is not guessing. The answer is a careful review. A very helpful question to ask your doctor is this: could my morning dizziness be related to my blood pressure when I stand up, my hydration, or my medicines? That question opens an important conversation. Another good question is, should I check my blood pressure sitting and standing? And if you have had a fall, a near fall, or moments of feeling confused or unusually weak, please mention that clearly. Many people hide those details because they feel embarrassed. Please don't. Those details matter. Here's the small habit I promised you, and I want you to stay with me because this can be so useful. Keep a simple morning note for a few days. Write down what time you woke up, whether you felt dizzy, whether it happened before or after taking medicine, whether you drank water, what your blood pressure was if your doctor asked you to check it, and whether you felt better after sitting down. That little pattern can tell a much clearer story than one random bad morning. It can help your care team see whether the problem is a blood pressure drop, low blood sugar, dehydration, poor sleep, or something else that needs attention. And please do not blame every symptom on getting older. Aging changes the body, yes, but repeated dizziness is not something to simply accept. The same is true for morning chest pressure, shortness of breath, a racing heartbeat, or unusual weakness. Those are not symptoms to push aside and hope for the best. If you ever have chest pain, trouble breathing, fainting, severe confusion, sudden trouble speaking, sudden trouble seeing, or weakness on one side of the body, get emergency help right away. Do not wait it out. Minutes matter. There is one more common morning mistake I want to mention, because it hides in plain sight. Many people wake up after a bad night, skip breakfast, take all their pills, rush into the day, and then wonder why they feel shaky or drained. Your body needs steadiness. For some people, especially those with diabetes or people taking medicines that can upset the stomach, a small balanced breakfast can help the morning go more smoothly. Not a huge heavy meal. Just something sensible that fits your health plan. If you are not sure what works with your medicines, ask your doctor or pharmacist. I also want caregivers to hear this. If your mom, dad, spouse, or loved one says, "I'm fine," but you notice they pause after standing, hold furniture, or look pale and unsteady in the morning, pay attention. That is a clue. You do not need to panic, but you do need to notice patterns. Caregivers often see the warning signs before the person living with them admits there is a problem. Your calm attention can prevent a fall, a hospital visit, or weeks of lost confidence. The good news is that this is often a place where small changes help. A slower start. Better timing. A medicine review. Safer blood pressure checks. A little more attention to hydration if your doctor allows it. Better sleep. More honesty about symptoms. These are not dramatic changes, but they are powerful. They help protect your heart, your brain, your balance, and your independence. So tomorrow morning, do one kind thing for your body. Do not leap out of bed and rush into the day. Pause. Sit. Breathe. Stand slowly. Notice how you feel. If something seems off, write it down and bring it to your next medical visit. And if this message made you think of someone you love, share it with them today. You may help them avoid the morning mistake that so many people never realize they are making.